Okay, we're going to talk about delirium, which is different than dementia. But what we're going to look at is it's a disturbance of consciousness, cognition, or attention. It develops over a short period of time, changes throughout the course of the day, and the change in cognition is not caused by dementia. So, go over a couple things. So you get delirium here. And we're going to draw this guy. This is who is the face of delirium. Like this, and you've got kind of a sad face, angry, kind of an angry face, and that has to do with the psychomotor agitation. And you've got one eye open. And one eye closed, and that's impaired consciousness. And you've also got disturbed sleep-wake cycle. So disturbed. Now, you're going to have this big sign that says, pay attention. And the reason is, there is attention impairment. Now, if you go into the guy's shoulder, you're going to put in a sun that's going down, or sundowning. Which means it's worse later at night, but you've got that sundowning or worsening of symptoms at night, which is the sunset. You got this little guy, the delirium guy, asking what, where, who am I? And that's because it's impaired memory. You've also got, you're going to put a moon here. The moon has to do with lunar or lucidity. And on top of the guy's head you put question marks, which in some respects that often means mental retardation. With this it's confusion. So forget that part, but you get confusion and lucidity, impaired memory, sundowning, attention impaired, psychomotor agitation, impaired consciousness, disturbed sleep-wake cycles. Now, a lot of the causes can be post-surgical, metabolic disturbances, including, things like hyponatremia, hypoglycemia, hypoxia, hypercapnia, hypercalcemia, anemia, infections causing urinary tract infections, meningitis, pneumonia, sepsis, endocrine causing, including hypothyroidism, hyperthyroidism, head trauma, seizures, thiamine deficiency, which is, Korsakoff's, so pay attention to that. Substance-induced, causes include alcohol, benzodiazepines, opioids, hallucinogens, stimulants, sedatives. Substance withdrawal, including alcohol, benzodiazepines, and barbiturates, can cause delirium, along with hallucinations. So, you can put in their hallucinations. But, these are all can be done by medical conditions or substance intoxications. Now, we're going to put a clock over here just so you kind of have an idea. 12, 6, 3, 9, and you just what the clock can mean, onset is from hours to days. Course changes within the day and may include periods of both lucidity and confusion. So we're just talking about lucidity and confusion. Consciousness is impaired. That's what the eye closed is for. Attention is impaired. That's what the sign is for. Cognition is impaired, including memory, language, and orientation. Where am I? Hallucinations can occur. We talked about that. And disturbance in sleep-wake cycles. Psychomotor agitation, things like pulling out IVs or catheters, or just angry. I forgot the nose. It's just an angry person or angry face. Worsening symptoms at night is the sunset. So keep all those things in mind. The treatment, it depends on the underlying cause. Haloperidol is used, so I'm going to put treatment here, and we're going to put this is Hale's doll. Hale's doll equals haloperidol. And lorazepam can also be used, which is a benzodiazepine. So use clocks or calendars to aid in orientation. Restraints can be used also. So underlying cause first, then haloperidol or benzos.